No, you're okay. You're okay. Safety first. We're good. We're good. Math wasn't working. It's a big file. We're trying to get, well, the good news is Vanessa Gibson's going to be graduation. Virtual, but it's awesome. No, right? And then trying to see if we can, like, probably won't have time to provide people now. Ready to stock the mayor, everybody. There's this partnership with Walmart right now. So we want to have in-person outside. That's hard. So hopefully we can do that. Well, I'm hoping we'll have it like our celebration. We literally just started talking about it. It's not great since it's 2 months away. But you know, a celebration, some kind of gathering. We're not sure yet.
Not back here. It's underneath. Okay.
Partnership is with Woman Rate, but they're trying to have a more equity-focused presence, and so they partner with us. They're getting Harlem, so I don't know. Hopefully we can get that. Like the great performances is part of the partnership, but you know, I mean, we had part of the hall that time at Wagner's back.
Yeah, that was awesome.
No, I don't know if we can get it.
I know some good stuff.
Alright, well, we're trying to figure out. Maybe we should have you on the hosting.
Yeah.
Are you up for that?
Yeah, I'd be down. I've been doing a lot of poetry.
Well, maybe we should just hire you.
Yeah.
Actually, I'm like, duh, Tanya. A little slow, sorry. I broke the coffee thing, and so I don't have that much caffeine in me.
It wasn't good.
Okay, because I totally was like, oh man. Yeah.
I wasn't doing the thing I was supposed to do.
How's business?
Good. I mean, I haven't been operating my catering section.
Okay.
I just really focused
I'm sure it's not spoken, right?
I mean, my friends that are doing the catering, they're making good money.
Okay.
They're doing like private, like,
Okay.
so, but I can definitely connect with that.
Well, let's think about this because maybe the showcase should be like, I mean, I don't know if there are other grads that are also culinary business entrepreneurs like you are. Maybe that's part of it.
Yeah. Or even like the art aspect. I'm really into the art scene.
Okay.
Doing a lot of poetry. So that could be something as
Yeah.
well, like showcasing black art
Yes.
and local
Because
artists.
literally, we're just creating it literally in real time. So a while ago,
Sir, are you on the panel today? Cheek Musa. Say again?
I'm with Cheek Musa.
Cheek Musa?
I'm on the panel.
Okay. The first two rows are for members of the administration and people on the panel.
I was
That's,
told I could sit here.
okay, I'm not trying to give you a problem. Just following orders here. Yeah.
They basically want to start a social enterprise that is like indoor farming, partner with entrepreneurs, and NYC. So basically create a space where the non-PCF business pathway graduates and the PCF graduates are more connected, but potentially for more ownership through these businesses that are connected to the farms and growing food around to like do whatever business. And so we're like, that's a great idea, except they were basically trying to pitch it to Adam. So we're like, we're interested in exploring the idea, but we can't just like automatically commit to it without actually being clear about how it's going to work. We don't know if NYC says yes 100%. So if it actually picks up momentum, my whole point was I was looking for you and Paul and Daniel to sort of like weigh in and be like, happy idea, or does it make sense, or what part? Anyway, so
There's a lot of things. Like as soon as you said it, I was like,
I know. So I do want to share that. I do want to share it with you guys at some point. It hasn't been a party because we haven't moved on it, but that's what I was trying to do. And I ran into Daniel once in the office, and then Paul's actually been with us, but he's actually just left. So he's around, but but I still, if it'd be great if I could still figure out a time that works for you guys.
yeah, that'd be great. Especially because Paul has a lot of experience with groups and
It's really like, what are the things that we need to like make sure happen?
If you yourself are not a panelist, you must sit behind the second row. Oh, I'm sorry, hi. Are you a panelist?
Yeah.
or-
Yeah.
Okay, great. Sir, if you could please, take it up. Thank you very much.
Take it up with the commissioner.
Yes,
I
please.
know her very well.
Yes, please do.
so hard to touch it off. You said you know the commission. I don't know.
That's hilarious. So you know what Pierre was telling me yesterday? I found it responsibility. I'm like, I was looking at emails and you know, Tracy, it wasn't clear. They told me you're going to panel. I was like, that's great. You know, panel. You're supposed to be on the panel. It was very confusing. And she's like, I'm sorry, it's a little hectic. There are a lot of new people in the mayor's office. There was a flyer. You may have seen it, but I didn't see it. But it said, like, apparently there's a there was a flyer that had been just because the routine was commissioner.
Oh wow.
Like, she's like, somehow they helped her to the agency. I was like, oh, I got promoted. I was
Voted to
like, does that mean I get city benefits because I'm voting? That because those benefits are sweet. I remember from my 90 days.
I love that.
80% benefit. Anyway, it was like, oh man.
Oh my god. But like, you know when I came on and I wrote, like, originally for this place, I was going to have a relationship. They were like, oh, we're going to have a coffee shop with Brian Martin.
Okay.
And I was like,
Huh. Yeah.
I'm reading it like,
Yeah.
no, why did you think this was nice? Yeah. So it was good. Like we were in the meeting and then John Showgirls, who was working with Castro,
Okay.
kind of like pitched like a refund
Okay.
where we could just improve business tax grads to provide to Metro residents who didn't have insurance.
Right.
And so we just redirected funds that way. And then we also used the grads to be able to work with the wholesale to work with, Bronx City Wholesale. And so I was really excited about that because they already had we had the budget, so they didn't have to pay for any of the shit stuff.
That's good.
And we paid them to make the food, and we paid them to be the commercial. So it was great, but that's kind of what happens when people don't really know the programs that well, and they're like, oh, this is a really great idea.
Well, I had to slow the roll. No, they were great. But multiples. It's literally been months of conversation because of exactly the point. They're gonna, these great ideas. I was like, hold on. Like they're trying to leverage the wealth of the wealth. And I was like, but you realize you can't do it the way that they're gonna want to do it, right? So, like, I'm telling you now, that's anyway. So it's been an education. I haven't closed the board yet, but I didn't say yes, so it's okay. And actually, do you remember? Do you know Immigrant? Yes. So Immigrant's on our board. Is he on your board? Yes. I know. And so he is also because he wears the 4,000 hats.
Right.
Also is a consultant to NYC. So he was on kind of some calls.
Yeah.
And I was like, you are my favorite weapon because technically I have actually notified the board because you're on the board. So anyway, I did not say yes, but I did discuss like possibilities. So when we're ready, we'll be like, okay, Ibrahim, tee it up.
Yeah, I think that's a great idea. I was also thinking for farm school, this idea of like a community chart that's like full of like event communities and it's like fully dependent on the farm. So you're getting permission, right? Or even like where all the farms come together and form like one big farm.
Yeah.
And do like a CSA. You know what I'm saying? Because I feel like, yeah, Grow has a CSA, but it's not always beneath every community. And every community is different because they have different demographics. Right. They have to, reshape the crop plan a bit to fit the community. Right. And so like if you had a way where folks were able to get these like CSA boxes and like you had a group that was like the big structure for all of the little gardens to turn it into a collection, like that would be amazing. Because that's like all the overhead that they can do, but all the growing that they're doing.
Yeah. No, that makes a lot of sense. Wow. Many things.
Yeah.
My wheels are crazy. What is that what you're doing now?
She's not at Bravo.
I know, but that's all I heard. I didn't know. You know he's okay?
Creation.
Oh. I just figured she went off to some other fabulous thing that she did. Interesting.
Yeah, you should hit her up.
I do want to hit her up. No, seriously. Really? Oh my God. Did you tell her that I'm like I'm very curious?
Looking for you.
Yes, I am very eager. I was like, okay, how is she doing?
Yeah. Because I just heard she,
This is current. I love this current.
and I also have a big for her.
I was gonna ask Domingo.
You might not know.
Testing, 1, 2, 3. 1, 2, 3. Testing.
Yep, that's the one I got.
All right, we'll try. Interesting. Want to shake things up a little bit.
As you should.
I'm trying.
As you should.
I know.
Tuesday morning, I have a all-staff conversation
Because we had hired this group called Third Settlements, which is
Testing, 1,
my
2, 3.
male-led
Hi, how are you? I'm Chantelle
equity consultant. They started
I'm not.
surveying staff. Who are you with?
I'm with Mimosa.
Staff, graduates.
Healthy lifestyles.
Okay, I can use some of this, but anyway, kind of like address some realities. It takes a while, but I'm trying.
That's all you have to do is like be transparent, one day at a time. You know what I mean? Because like for all of the bad, there's all of the best.
That's what I'm trying to.
Yeah. You know, it's just using the people that are already there for this mission because they have really good ideas about quick fixes. If we did it this way, you know, things will be more efficient.
Right.
I would could do more innovation. I would be excited to do so.
Help people. I'm also trying to, well, I'm not trying to, I am, part of the growth plan for the next 5 years. We frame it as the first term for the enemy. So we're going to Queens this year. Site Queens. In all 5 boroughs. Increasing board membership. To have like a certain percentage of what so I, and then a whole bunch of other things.
Yeah.
But trying to be very
Testing 1, 2.
I got the presentation. So, yeah.
Well, we're just finished orientation for cohort 23. They start preparing now. Okay. All right.
Yeah, so it was great. We're talking line surveys, we're talking feedback scores.
They don't
It
understand.
was a 2-hour workshop. I was like, we need more time.
Oh, wow. Okay. Like, you gotta, my time is money, people.
But it was really great. And we did, I trained 10 trainers to also teach students. Yeah,
So you said you got 3 sites, 2 in Bronx and 1 in DC.
yes.
And how many folks do you have, like,
It's like, so I have the community members, and then on my team, I have like 2 separate teams. So I have a team working with the school garden. They do like a lot of the logistical part of it, and then I have a space team who do like all the work that work. And then I do all the organizing.
Dear. Unfortunately, I guess our new mayor is following the habits of the old mayor. Unless you got
Il dit que, voilà, c'est fermé à tout le monde. Personne, oui, c'est pas seulement toi. Ça, c'est seulement le bureau du maire. Ça, c'est live stream from the HSC, référence pour les hôpitaux. Ça, c'est live stream dans les hôpitaux. Ça, c'est le maire. C'est fermé pour tout le monde. C'est pourquoi tu me vois par la presse. Hein? Mais après, tu peux faire des interviews. Hein? Ok? Ça va bien? Ok? Donc, je veux seulement que tu te rassures que ce n'est pas toi seul.
Yes.
Ce n'est pas public.
No, I know.
Je comprends.
6 months ago.
Non. Le maire vous a écrit, mais le maire aussi est invité. C'est pas le maire qui fait. Le maire aussi est invité, mais c'est un événement organisé par les HSC. Voilà, donc ils ont cette liberté de choisir qui va. Pourquoi tu ne vois pas les autres
No, he's
personnes?
actually he's been working
Ok?
with,
Donc je voulais juste me rassurer parce que quelquefois, un malentendu fait croire que c'est personnel. Non, c'est pas personnel. Elle m'a dit que c'est pas ça. Ok?
liberation training and equity training and yeah, just like outreach, community engagement, training, whatever. Oh my God. It's like
Yeah, I think I was
I believe me, I am thankful every day. Every day I try to lead my day with gratitude. Many things. And even this, I was like, his birthday was last week, of course, so on the orientation. And because I'm he felt anything, I was just like, are you interested? And he said yes, and then I was like, and he's trying to do this, and I was like, I'm not sure what it is. And I was like, time, island. Like, I want to talk to you.
Yeah.
Because I didn't want to turn him around. I didn't know.
Yeah.
And then last night he was like, what should we wear? I was like, what do you think? All right, well, after this I am going north. I was supposed to be away for the weekend, so I'm going to go. But I'm happy that it's helpful that this is in the Bronx, not and see if they make me come back.
Merci mon cher. Double, ça va? Salam alaikum. Ça va? Ça va mon cher, mon cher.
Excellence. Ça va? Salut papa.
Hey! Good. How you doing?
We need to talk because
I don't know about that. Yeah, somebody just put something.
I think they said the first three
How's everything?
How did you make it in here so fast?
Believe me, it's a community that needs to work with people. No, and I appreciate you.
language is that, man? What language is that?
African language.
Oh, no, I speak Chi. You good at yourself?
Good afternoon, everybody. If you can take your seat, we can get started.
Yes.
I cannot sit there.
Good afternoon, everybody. I'd like to wish you all a big welcome to Lincoln Hospital, H&H Lincoln, here in the sunny South Bronx. Although we did have a little snow today, that's okay. It's still sunny in the South Bronx. We'd like to welcome you here for Black History Month in this joint celebration with the Mayor's Office of Immigrant Affairs. Commissioner Castro is here, as well as others. And we want to talk about how we can participate in transforming and ending health disparities that have plagued our city and our country. So this is just the beginning. And I just want to point out that all of you saw the red carpet out front, right? That's for our patients, because we really want to give our patients the royal treatment. And it starts at the front door. So red carpet, classical music, and a big welcome to all of our patients that come to Lincoln for health care. And we're going to have a message from Chris Roker, who's our CEO.
Good afternoon, everyone, and welcome to Lincoln Hospital, and welcome to Black Health and Black Wellness. I would like to thank the mayor for coming in and talking with us in the panel discussion. I think it's going to be very informative for not only our community, but also the folks in the hospital, and the importance of really taking care of not just Black people. It is our whole community, Black and brown, and the importance of health and wellness. So once again, thank you for coming, and welcome to Lincoln Hospital.
Great. Now I'd like to introduce somebody who's working very hard for the Bronx. Vanessa Gibson, please come on up.
Good afternoon, ladies and gentlemen. Welcome to Lincoln Hospital. Happy Black History Month. Black history is American history, and American history is Black history. We are so grateful to come here to this space today to celebrate our ancestors, our trailblazers and pioneers, the African American leaders upon whose shoulders we are so proud to stand on. And I, as your Bronx Borough President, Vanessa L. Gibson, making history as the first African American and female elected for a better tomorrow for all of our people. Whether you are African American, you are Latino, you come from any other country, we are all African people. And when you think about this month of February, while it may be the shortest month on the calendar, if you know like I know, we celebrate our Black heritage every day of every month of every single year. We are so grateful for the incredible opportunity that we have been given this afternoon to celebrate Black History Month. I am so honored to be your borough president, and I am thankful for all of you. It's only been 7 weeks since we first took office, but we have hit the ground running because we know that we are here to serve for such a time as this. And in honor of all of our ancestors, those that have come before us, those that have paved the way and laid the foundation, those that have placed their footprints in the history, we are standing here today to recognize their legacy, to celebrate their labor, and all of the seeds that have been planted before what you see today. Whether it is our mayor, Eric Adams, who is here, commissioners who are here, all of our commissioners who are here, the executive staff, we have members from the General Consulate who are here, all of my African people, my brothers and sisters, it is our time. This is our moment. This is our chapter. What are we going to do to create the next generation of young people? Black History Month is about our affirmation of our people, our culture, our diversity, our heritage, the good food, the great music. It is about us all coming together, recognizing that while we may come from different places, we have so much more in common than we do that ever divides us. And so Black History Month is a reminder of the struggle, the resilience, the strength, everything that we have overcome as African Americans. And yet we are here to tell our story. It means nothing if we don't do anything with the titles that we have been given. And so this is our moment, people. Black History Month is a chance to celebrate, have a good time, recognize those that have come before us, honor our pioneers and trailblazers. But guess what? In the words of our mayor, we have to get stuff done. We have to focus on Black maternal mortality and morbidity, and the fact that too many Black women are likely to die during childbirth because they don't receive equitable health care. When you talk about health care equity and justice, when you talk about making sure that there is an intersection of health care and public safety, like the great work that's being done by James Dobbins and Guns Down, Life Up. So when you understand that all of these issues are correlated, we can't talk about health care without talking about stable housing and good schools and access to opportunities for young people like summer youth employment and making sure that our streets are safe. That's what it means to recognize Black History Month. It means that we have to be in the trenches, talking to our young people and all of our stakeholders and making sure that we recognize the purpose that we have been given. And so it is my honor. While I am the first, I should not be the last. We need to cultivate a new wave of leadership that looks like our communities. You can't be what you can't see. And our young people need to see all of us in leadership and know that their destiny is not determined by the block they live on, nor the zip code. Michael Blake, we always talk about your block not blocking your blessing, but children of God being the future, giving them a real pathway to be a success story and not a statistic. That's the work of recognizing our ancestors during Black History Month. So I thank you, Dr. Marshall. I want to thank our President and CEO, Dr. Christopher Roca, and everyone here at Lincoln for all of the great work you do, saving lives every single day. First responders and essential workers, we salute you and all of the community residents. Thank you so much for never giving up on all the hope and all the possibilities. Continue to live out our ancestors' dreams. by doing the work that we have all been called to do. Happy Black History Month, my people.
Thank you very much. The next speaker I'd like to introduce Manuel Castro, who's the Commissioner of Immigrant Affairs and a co-partner with Lincoln on this journey. Commissioner Castro.
Welcome everyone. I am so thrilled that the Mayor's Office of Immigrant Affairs has partnered with Lincoln Hospital to host such an important and such a beautiful event in celebrating Black history, and to see so many great partners and friends in the audience today. I want to begin by echoing the words of Mayor Adams that we honor Black Americans who sacrificed their lives and livelihoods to pave a path for all to walk in. The immigrant community, including myself as a former undocumented dreamer, have benefited tremendously from the work and contributions of our African American brothers and sisters. And so we come together to celebrate and honor Black heroes and sheroes who came before us and who continue to inspire us to build on their legacy, to fight for a world that we can all enjoy and live with dignity and respect. We are here specifically to heed the call to action from our Mayor, Eric Adams, to start a movement towards health and well-being in our communities, and to together dismantle the inequities that impact all of us. And so from healthcare workers, to taxi drivers, to bodegueros, to the consul generals here today from Africa, the Caribbean, Latin America, Asia, and more, to leaders of our sister agencies and our community-based partners and elected officials, let's come together and commit to working together on this important cause. And so I am honored here to sign Lincoln Hospital's Lifestyle Pledge of Unity and pledge to work with you all to create a strong village and end the inequities and fight tirelessly for the future that truly values us all, with not just words, but critical action. Count on the Mayor's Office of Immigrant Affairs to reach some of the hardest to reach communities and to ensure we are delivering the best linguistic and culturally competent services for all. And so with that, please join me in welcoming our friend, our leader, the Mayor of the City of New York, Mayor Eric Adams.
Thank you, Lincoln. I have been waiting to come to Lincoln because I'm hearing just so much about what this hospital has offered, the amazing team throughout the entire pandemic. This team has stood up and allowed people to know that quality health care is where you can have it in the most famous place that I can think of, the great borough of the Bronx. Yeah. The DX is in the house. To my amazing commissioner, Commissioner Castro, you just bring just the intelligence, the compassion, and the need as we talk about evening out the playing field for those that are part of our immigrant community, the immigrant diaspora. And what many people don't realize that we're not on the ground during COVID-19. When so many folks were able to remotely do their jobs and occupations, our immigrant diaspora were on the ground ensuring that this city remained open. Who do you think delivered your Uber Eats? Who do you think made sure your stores were stocked with food? Who do you think was driving you around all the time? Was making sure that we were able to keep going going as a city. They did not remotely do their jobs. They were on their jobs, and we owe them a debt of gratitude. And no matter who you are, we've all come from some place. So I say to my African diaspora, my Dominican, and my other groups in the city, when someone tells you to go back to your country, tell them you will when they go back to theirs. We all came from somewhere, and that is what makes America amazing. Amazing commissioners, part of the team I am building, and my team looks like New York. My team looks like New York. Commissioner Mermerstein is here. I'm sure he's here. The International Affairs team that's here. Commissioner Jenkins that's here. Commissioner Kim. Where's Commissioner? Commissioner Kim that's here. Commissioner Sherman, Executive Director of TREE. And all of the council generals that's here. We're all in this together. But in order to help people who are going through a lot, you must have been someone that has gone through a lot. That is how you understand the needs of people when you come from the place that they are located and you have gone through similar circumstances. Black History Month is not a month. It's a calling. It's a charge. And let me tell you something. I hear this all the time. People say how hard things are. Let me tell you about hard. Hard is what I saw in Goree Island a few years ago. Hard is what I saw last year in Ghana. Hard is being in dungeons, being there for months, living in your own waste, having someone rip your baby from you, abusing your children, only to get on the ship, never to see your home again, and reach even a more horrific destination when you get here to America, working from sun up to sundown, delivering your child in the fields just to go back and continue to work for hours. That's hard. And when we think about the state that we're in right now, think about the state of those who made it possible for us to be here. We desecrate the lives of the African diaspora when we come here and don't stand up to their legacies and their sacrifices and commitment. We owe it to them not to talk about his story or her story, but to live out those stories on our own so generations will reflect on we were present for the moment. We cannot live in a city where bullets carve highways of death, taking our young people from us. But we also can't live in a city where we continue to produce trigger pullers, where we continue to produce those who believe there's no other way for them to go to participate than participate in criminal behavior. We can't continue to produce a city where 65% of black and brown children never reach proficiency in the Department of Education. We can't produce a city where only 21% of foster care children graduate from high school and 3% graduate from college, more likely to be arrested, living in homeless shelters, or victims of crimes or participate in crime. We can't have a city where 30% of the inmates are dyslexic because we didn't give them the services they need in school. We cannot have a city that we watch opportunities go down while buildings go up. You need a mayor that's one of you. That's what you have right now. Let's not use our energy fighting against each other.
Right.
Let's use our energy fighting for each other.
Yes.
That's what this moment is. 109 mayors did not understand you. You got the 110 that comes from you. So don't tear me down. Lift me up.
That's right.
I am not perfect. I'm perfectly imperfect. But my love of you is perfect.
Yes, Lord.
And every day that I get up, I'm fighting on your behalf. And when I err, when I fall, Think about these great people who have erred and fallen. And they still gave it their all. That's what you're going to get from me. We have enough naysayers. I want some yay-sayers.
Yes.
We fight against the things we hate. Now let's mobilize for the things we love. That's the history we need. That's the moment we're in. This is not just a month of acknowledging and reflection on the history of black people. This is a month of renewing our spirits. And when you lift up black history, you're acknowledging the fact that Chinese Americans built the transcontinental railroad system and they could not ride on those trains. You're acknowledging the fact that many members of the Muslim community came to America just because they wore a hijab or worshiped in a mosque, they were treated unfairly and demonized. You acknowledge that Irish were here and saying, no Irish, no dogs allowed. You acknowledge that Italians were treated unfairly because of a small number of people that participated in criminal behavior. You acknowledge that Jewish Americans that fled Nazi Germany had to have ships turned back because we did not allow them to come here. You acknowledge the contribution of our Spanish-speaking and Latino communities that have been denied for so long. You acknowledge the Caribbean diaspora, who have went through so many challenges when they came to these shores. When you acknowledge our history, you acknowledge the history of every group that have come here. You look at the fingernails of every ethnic group in this country, you see the dirt and grind of climbing up the mountain one hand at a time to participate in the American dream. America is like the soup guy on Seinfeld. It hates you until you force them to allow you to sit at the table and say, you're going nowhere. You are participating in this country. So this is our moment. We are refueling ourselves in this moment of history. And this great hospital, this great institution, is telling health is wealth. How we feed, nurture ourselves, not only physically, but emotionally. The trauma that we have gone through has changed our lives.
Yes.
We can come out of this with the continuing inequities that we existed before we got here. Or we can leave and be better human beings. That's what I want to do. I need your help to do so. We need you because we need each other.
Yes.
This is our moment. I believe in this city and I believe in this country. I say over and over again, this is the only country where dream is attached to our name. It's no German dream, it's no Polish dream, it's no French dream, but done it is an American dream. It's an American dream. And that dream cannot be a nightmare for anyone. And so I thank you, Lincoln, for allowing people to materialize that dream and see the possibilities. To my commissioner, thank you for this partnership. You are such an important entity to what we want to do in the future. Let's make it happen. Let's get stuff done. Thank you.
As the mayor mentioned, we all come from somewhere. So I want to recognize some people and some places that we are from. El Hajj Ndao, Consul General of Senegal, is here. Welcome. Ahmed Fati, Ambassador, Deputy Permanent Representative from Gambia. Welcome. Essa Kanfuru, Ambassador from Mali. Welcome. Marie Madeline Abui, Deputy Counsel from the Ivory Coast. Welcome. Manuel Arazo, El Salvador Consulate General. Welcome. Marita Landavari, Peru Consulate, Consul General. Welcome. From the Dominican Republic Consulate, Eligio Vargas, Consul General. From the Colombia Consulate, Susana Berenger, Consul General. From Paraguay, Carlos Ortiz, Consul General. So, welcome to everyone. You all make up the Bronx, and we are glad that you are here and part of this celebration, and we want to be your partners in improving healthcare in your communities and in the South Bronx in general. So we do have a panel discussion that's going to happen now, right? Panel discussion? Okay. So Dr. Watkins and Ms. Sadea Sherman, come on up. And the panelist, Charmaine Ruddick, patient from
Testing. All right. Okay. Good afternoon, everyone. Good afternoon. I know Mayor Adams is a hard act to follow, but we hope to keep the momentum of the afternoon. And I think, we echo the mayor's sentiment that Black History Month is not just a month, it really is a call to action. And so today's conversation will be focused on Black health and wellness within our community and the things that we can do, the actions that we can take to make sure that we stay healthy and that our families and our communities are healthy. So to get started, I am going to call up our panelists, and I'm so glad to be here with my co-moderator, Dr. Julian Watkins. And as we call up our panelists to the stage, if you could come up to the stage, I will share a little bit more about you. Okay, so to my right is Pierre, Executive Director of the Haitian American Caucus. Mr. Pierre is co-founder and Executive Director of the Haitian American Caucus, which is a global community development nonprofit whose mission is to provide the Haitian communities around the world with access to information and resources that will foster self-development and success. I'd like to introduce, one second, my brain. Mr. Sheikh Musa, who is founder of the Healthy Lifestyle Campaign. Sheikh Musa is founder of the Muslim Media Corporation, the publisher of the Muslim Community Report, New York Parrot, and Parkchester Times newspapers. He's also the creator of Lifestyle Lifespan that coordinates the New York Healthy Lifestyle Campaign, which was adopted by the New York City Department of Education in the Bronx in 2020. Next is Francisco Marte. Francisco Marte is president of the Bodega and Small Business Group Association. Francisco was born in the Dominican Republic and at a young age migrated to New York in search of the American dream, that same American dream we just talked about. He got his first job working at the High Brother grocery store where he rose to become a manager and later ended up owning the store. He has a typical immigrant experience where he started on the bottom and rose to the top and is a symbol of inspiration. He's the founder of the Bodega and Small Business Association, which reaches over 12,000 businesses in our city. Welcome. Is Chantelle Kent, who who is garden coordinator, school gardens at Grow NYC. Chantelle Kent graduated high school with a major in hospitality and tourism. She later went on to serve as an AmeriCorps intern with Green City Forest, maintaining and building 5 farms at NYCHA properties across the city. After her service year, she was the assistant farm manager in Brownsville, Brooklyn. She then transferred to being a farm's market manager in Red Hook, Brooklyn, an education assistant, a community chef, and she is now the garden coordinator with Grow NYC. I will also just add she has an amazing catering business called the Black Kitchen, which also has food. And then last but not least is Tanya Gail, who's executive director of Green City Forest. Before becoming executive director of Green City Forest, Tanya led Green City Forest development team from 2014 to 2020. She is a board member of the CORE Network, which is focused on national service, and Environmental Advocates of New York, which is focused on environmental justice. Prior to joining Green City Forest, Tanya served in a public-private partnership capacity at the New York City Housing Authority, and as well as served as sponsors of Educational Opportunity, which is a career program. She spent most of her career in the nonprofit sector, focused on economic justice and the issues of young people of color. She is a proud Brooklynite. I'm sure Brooklyn is represented today. Brooklyn's always in the house. And she's passionate about providing young people with viable pathways to create and lead a just and equitable world. So before I turn it over to my co-moderator, Dr. Watkins, I also want to share a little bit about him. But first, let's welcome our panel and give them a round of applause. So Dr. Julian Watkins is an internal medicine trained physician and public servant at the New York City Department of Mental Health and Hygiene. He is a health equity advisor in the Center for Health Equity and Community Wellness and is lead of the Immunization Justice Working Group, a group that is tasked with empowering city workers and providing information on the ongoing pandemic, the available COVID-19 vaccine treatments, and other treatments available. Dr. Watkins is also a culture of health leader, a part of a national leadership program supported by the Robert Wood Johnson Foundation. The program forces collaboration between people from all fields and professions that have an influence on people's health to build a just and thriving communities. So to kick our conversation off today, Dr. Watkins is going to frame our discussion, starting with the topic of mental health. So I'll turn it over to you.
Thanks for that, Cydia. Really happy to be here today, live, in person, masked up here in the Bronx at Lincoln Hospital to have a really important conversation, very timely. It's been 2 years since this pandemic has started, and we've learned a lot of lessons, and I think it's time to have a conversation about those lessons, the things that worked for us, the things that didn't, and also we can take the moment to acknowledge what we've been through, the traumas that we've experienced, the lives that have been lost, and just to really reflect on that. And as we look forward and move forward through this conversation and through this year, to really think about how we can honor those folks who we've recently lost, who recently transitioned into ancestor roles, and how we can, have these conversations, these important conversations. And so we wanted to start by, naming these things, but also to really talk about mental health, acknowledging that this pandemic has been hard for all of us. A lot of us, we've been affected. This city has lost nearly 40,000 people to COVID. That's not even accounting for others that we've lost because of they've fallen out of healthcare. They've delayed treatment, or they've experienced other bad things have happened to them, and it wasn't directly COVID, but we've lost them too. And so when we're thinking about mental health, I think we also want to talk about children and the effect that this pandemic has had on our kids. We recently had a health opinion poll from that the health department did, and about 1 out of all the parents on there, they reported 1 out of 3 parents said that their children had been affected negatively in their mental health because of this pandemic. 1 out of 3 of our children. And thinking about that, we can actually, pivot and think about what we can do to help those kids, and to what we can do to move through a lot of what we, these cultural things, but we don't talk about this. We don't talk about our mental health. That's not for us, psychiatry and all of that. That's for sick people. That's for white people. We don't do that. We just pray. We can pray and talk about these things. And I think as we're here, we should start talking about it and talk about what resources we do have in our communities. And so I think as we start the conversation and talk a little bit about mental health, I wanted to pass to Francisco and talk about, your work in the bodegas and the role that you played in, helping keep your community safe. I think it's so vital and important.
Yes, the bodegas, they are very essential. During the pandemic, we were working, we was risking our health, we were risking our family health to support the community, to bring what the community needs. We have, the Bodega Association has a program since 4 years ago. We've been working with the Healthy Bodegas. It's a plan where we've been talking and training the bodegueros owner how we can bring more healthy food so we can improve the health of our community. We know that our community, especially the Bronx, South Bronx, the health is not good for our community. They have a lot of blood pressure, diabetes, obesity. So we are working on that programs, and we are inviting all of those different groups and religious base that we can come together. That's the only way how we can resolve or help to resolve the problems, when we come together to help our community. And that's what the bodegas we're doing. We're willing to keep doing that. And most of the bodegas now, we are bringing more healthy products, more fruit, more vegetables. And some of them we need even some program and some funding that we can help those bodegas that are in struggle, so they can improve their daily, to offer a healthy option to our community, to our kids when they go in the morning to the school. It's good that if they ask for bacon, egg, and cheese, you can have another option to offer them and tell them how important it is. Buy water, don't take a juice, buy water. Take a banana, take an apple. So we are working on that to make the health of our community better. But we have to do it together. That's how we can achieve those problems, coming together, working together with all of the group. Thank you.
Can you guys hear me? Okay. Yeah, I think that's a great point. Like, that's some of the stuff that we've been doing as well. Like, using the gardens as a focal point to support advocating for more healthy bodegas.
Don't hear you. Can hear you, man.
I'm sorry. Yeah, I just wanted to echo what you were saying and say that we have also been using the gardens as a community hub and a focal space to advocate for more healthy bodegas in our communities and to put more pressure on supermarkets to provide quality foods for our communities, and also to build trust and agency for folks to feel like they do have a say in what is being sold in their communities. And on top of that, they also have a say about how it's affecting them and how it's affecting their children. Because a lot of people don't really think about food when we factor into mental health, but literally having better access to food literally increases your mental health. When you eat better, it raises your cognitive skills and you're able to make better decisions. And so I think it's less, it's more about how we can get people to frame food in that way, to not think about healthy food as a luxury, but as a necessity.
Thank you for that. The conversation and what you just brought up reminds me of this quote from Bell Hooks, where she says, oppression is the lack of choices. And really thinking about that and feeling as if you have no other options, as if your road has already been paved and you're just going along. And I think, bringing the diversity to our, in our choices, down to the food that we can eat and all of that is really important. And so it's really important that you highlighted that.
So I know as we talk about mental health and connection, some of the ways in which we all stay connected during the pandemic was online, right? So I know the work that you do with your organization, with young folks in particular, is focused on making sure that communities are connected and that people have economic opportunities. So share a little bit more about that and the role that broadband plays.
Can everybody hear me? Yes. All right. How many people here have a cell phone? Raise your hand. How many people here communicate with your families through your cell phones? Raise your hand. How many people, if you didn't have a cell phone today, you wouldn't know where your children or parents or grandchildren are all throughout the day? Raise your hand. Right. Now imagine that there's still people in New York City who still don't have a cell phone, right? It sounds crazy, right? They still don't have access to their families. They still don't know if there's an emergency. If an emergency happens, they won't find out until they get home in the evening, right? So just picturing that in your mind and creating opportunities and access for people to stay connected, right? Imagine everyone else in your class is going to school online, but you can't go to school online because you don't have the internet or you don't have a computer, right? How do we expect for our children in our immigrant communities to be able to compete in the future for future jobs if we don't have access to, technology? So at the Haitian American Caucus, we're very focused on how can we help our immigrant communities through language access, right? Through partnering with MOIA, organizations like the Mayor's Office of Immigrant Affairs, to see how can we, right, position our immigrant communities in the next 10 to 15 years to be able to compete, right? The mayor just said, right, people are coming here, right? They're gonna be here, they're gonna have children, right? I'm a product of 2 Haitian immigrants, right? So I'm an American, right? But I'm a Haitian American. I want to be able to compete, but if my parents didn't have the access or the resources, right, to put their children into schools where they can compete, how would we be able to survive in the future? So, and incorporating that to mental health. Imagine, like I told everybody to raise your hand, imagine people who don't have cell phones, watching everyone else be able to call their family or call their children or be able to see what's going on. Imagine how that might make you feel as an individual. You're behind in life. Right, so that's why I think it's important for communities to have conversations like these, partner with the city, partner with organizations like MOIA, partner with agencies like NYC, who's helping bring access to the digital, so that we don't have this digital divide in our communities.
Thank you. And I know, I'm sure there may be some questions or comments on the topic of mental health, so if folks want to jump in before we sort of segue to some of the other topics. Tanya, I'll throw a question over to you. The work that you do is really transformative for the lives of young people. Can you speak a little bit more about the work you do at Green City Forest, and just also not only the professional development, but there's all this personal development that comes with it? Sure. Can you ready?
There
we go.
Okay, there you go. Yeah, so, hello? Oh, sorry. Green City Force, where we are a New York City Housing Authority focused nonprofit. We are a National Service AmeriCorps program. I'm very pleased and proud to share that Chantelle here is a phenomenal example of our graduate community who oversees a farm in Staten Island as part of our program, as the successful stories of the young people that really focus on driving change and transformation in communities. And so what we do at GCF is we really look to leverage the talent and strength and lived experiences of the young people who grew up and grow up and live in public housing to inform their fellow residents about a healthy way through large-scale farms that are built and managed by people, as well as all kinds of education around sustainability, how to be healthy, how to be nutritious, but it's also how to be safe and positive as leaders. We're part of a New York City Mayor's Action Plan Against Neighborhood Violence, and our young people are flipping the narrative of the stereotypes of young people living in frontline communities by creating change, growing free food, building their workforce skills so that they can be leaders in driving a green economy. So it's really powerful because the work is not just about job training and the work is not just about building skills. It's about unleashing talent and potential and putting it in the world in a way that's innovative because the voices of the people who are from the communities are while they build their own skills and building an infrastructure of sustainability and safety and nutrition and wellness, ideally, ultimately, and economic mobility and racial justice through the work that they're doing as members. So that's what we do. That's what they do. So that's what Justin does.
Thank you. So were there any questions, comments on the topic of mental health before we start to segue into a discussion around our physical health? There should be a mic. Oh, I think you can come to, oh, they'll pass it to you. Or
I also am pretty loud.
Because he's a young leader from
the only thing I had to add, and thank you for shouting me out, Tanya, but the only thing I had to add was, especially during COVID-19, just feeling like you have the choice helps the mental health of the community. So we weren't gonna, when COVID-19 hit, we weren't just gonna scramble and guess what's the best things, because they would know what's best. It's up to them in the community to let us know what will help them more. So it's not like we're gonna guess it. We wouldn't have guessed that one of the answers is, we want books. All right, you guys want books? So let's make sure we get a collection of books, hundreds of books, whatever you guys want, we're going to give it out with the produce. So it's more so asking the questions instead of assuming or guessing, because every community is different. But I just wanted to add that just feeling like you have the choice is extremely healthy for our community's mental, instead of feeling like you don't have the choice and detach yourself from those decision-making opportunities. But I just wanted to add that in.
such an important point. Thank you. So now on to the topic of physical health. I think, we obviously touched on the way the pandemic has impacted our mental health, but we know with our physical health, there are a number of us who've missed doctor's appointments. I'll raise my hand. I'm sure there's a lot of other folks in the room. And there's ways in which we may not be taking the best care of ourselves, and there's also ways in which sometimes the communities that we live in, right, may not be connected to the best services available. And so I'm going to turn over to Dr. Watkins to speak a little bit about this topic, and then we'll open it up to our panel.
Thanks. Yeah. Thinking about this pandemic, we talk a lot about our physical health. And when we saw early in the pandemic, we saw these inequities that hit us, right? We all started, March 2020, and then we saw headlines. Black people, Latin people are dying at rates higher than other people, and we're all questioning this black health, and what is it? Is there something wrong with these people? What's going on? Instead of asking the real question, what's wrong with this system that's failing these folks? Why are people dying? And turning that script, looking at the narrative in a different way, I think is really important that we start asking the right questions. And I think building off of the conversation about accessibility with Sam, this pandemic and other crises have the potential to destroy us, but they also have the potential to save us, because they ask us, it's an invitation to imagine how to do things in a better way, how to change things and go forward and actually make things more accessible. And we see things like telehealth, telemedicine as a way to bridge people to healthcare. I mean, years ago, it was just so inaccessible to even think that you could get a physical exam, talk to a healthcare provider from the comfort and safety of your own home. And now it's available. And now it's been integrated in all these big healthcare systems. That's something that the pandemic has done. Even remote school for kids, remote work for folks. So it's really opening this conversation and having us recognize, okay, we're 2 years into this. We can take a breath and then think about our physical health. What can we do beyond the vaccine, right, to actually take care of ourselves so that if we do come in contact with COVID, that we're going to be okay, right? It's adding these new healthy kind of lifestyle choices, but also not forgetting the stuff that we do know. We got to get our screening, right? We have to do our cancer screenings. We have to go and get our blood work. These are things that we got to do. We can't let that thing slip by, because I think as we're getting more information, we're seeing that in the COVID pandemic, a lot of folks have missed cancer diagnoses and treatment has been delayed. And I think we have to name that, and all from one starting point, it's never too late, to wake up and say, okay, let me get things together. Let me think about my lifestyle. And integrate a healthy lifestyle, visiting your provider, having these conversations with our family about the things, and avoiding that silence, that history of silence, where we don't talk about the uncomfortable things. The pandemic can change that. We can integrate these new ways of, being with family and call and check on your mom, but also, how's your blood pressure, mom? How's your cholesterol? These are things that we can do, and I think conversation about health and lifestyle is so important. So I wanted to pass to Sheikh Musa, if you could talk a little bit about the work that you do in lifestyle.
Absolutely. Thank you so much. Before I begin, I really would like to give shout out to Deputy Commissioner Mia Soto for putting this thing together. And also, I want to shout out to the mayor who gets it. This is the first time we have a mayor that gets it. And I know 100% in the next 4 years, we're going to be healthier, stronger, and a lot more well off. I have no doubt about it. We have a program that we launched in 2004 because we run a school. My wife and my family, they're there. We run a school, full-time school, K-12 in the Bronx. And we've witnessed that this is an immigrants county. Bronx is a county of immigrants. And among the immigrants who live in the Bronx, a lot of them happen to be Muslims. And among them, most of the Muslim women actually remain home. So the husband goes to work, do all the physical activities, but the wife remain home in sedentary lifestyle. And to make it even worse, the cultural food that they cook are very, very bad for their health. So now you have individuals who are not moving as much, not eating well, and that will translate in a long-term health and wellness issues. So we launched a program called Tea Out Stress, where we get these Muslim women to come and socialize and talk and laugh and do whatever, so that they'll be out of the house. And that program drove so much interest from them because they're leaving their homes, they're meeting others, they're socializing, and they're physically, being active. Fast forward to 4 years ago. 4 years ago, we launched a program called Lifestyle Lifespan. Lifestyle Lifespan. And we came up with 7 pillars of lifestyle, because you can tell people eat right and exercise, but what about if their financial condition is such that it affected their mental well-being? What about if their family and relationships are so toxic that they cannot concentrate? What about if their educational environment is so gang-infested? A whole host of things. So we came up with these 7 pillars: health and wellness, economic finance, education and profession, family and relationship, and community and civics, and spirituality and religion, and I'm forgetting one. But these are the 7 pillars. And out of these 7 pillars, we build a curriculum that will be taught in the public schools from early age, so that you have a whole rounded lifestyle change. The problem we have now is that in the Bronx, it's the greenest county in the 5 boroughs. We have over 22 hospitals, and we have double the community health centers. Yet, year after year after year, we are ranking at the bottom when it comes to health and wellness for over 10 years. That means our lifestyle needs to change. You can put all the money into these facilities, but if we don't change our lifestyle, what we eat and how we live and our relationship, our finance, then unfortunately we're just putting the money in the drain. And that is why we came up with Lifestyle Lifespan. And that program now has been adopted by the public schools because it makes sense. For the first time last year, most of the parents, including the principals, said they never heard of April as Minority Health Month from the federal government. And we reached out to the federal government. We said the Bronx doesn't know you have a month celebrated for minority health. And for the first time, the public schools in the Bronx celebrated April as Minority Health Month. And the students did a fabulous job. If you read what they wrote and their presentation, you think they're doctors. So what I'm saying is that in order for us to change the status quo, we have to change our lifestyle. And lifestyle, lifespan. Thank you.
I definitely want to speak to that message. A big part of lifestyle and even public, like physical health, is having access to green space. And we've noticed in a lot of underserved and Black and brown communities, folks don't have the same level of access to green space. If you even think about the culture that's surrounding green space in NYCHA or in other public housing, it's kind of like stay off the grass. Don't come over here, don't sit over here. This is not an area for you. So when you have that, and you also have areas that don't have the same level of access to public parks, and you also have folks that don't understand the value of nature and what that can do for you and your physical well-being, you know, it really does have a disconnect. And so when we talk about physical health, you know, I love to bring up having access to green space and just being able to walk on grass, to be able to smell flowers, to be able to see something beautiful in your community and know that that was there for you. To also feel comfortable to explore green spaces and to be out and to be in communion with nature is a great way for us to boost lifestyle in our communities. We don't have to have a disconnect. We don't have to think that nature is not for us or nature is for someone else. I think that's a mindset shift that we also have to have as well, right? It's like, how can we get back the equity, not only in dollars, but also in space?
Thanks for that.
Yeah, just building on that. I mean, for many years now, we have, and Chantelle is part of the building, we've built 6 large-scale urban farms across public housing in these very dense, concentrated communities, and especially during COVID, where people were like literally locked in their homes, having no access to explore, you know, not only the older people, but the younger people who may have originally heard about our program, and we've heard over the years, many people like farming. I don't know, farming, that's slavery, we don't do that. And you give people a chance to have an experience where they're agriculturists and they're learning about the actual legitimate history of like Black and brown leadership in agriculture historically, and you're literally watching your food grow and you know that you created it and you're nourishing your family and your community. It completely transforms not your physical but your mental health. And I've seen it time and time again when we have farm-based learning and the young people come in, the little kids in the school, and they think that all their food comes from the supermarket. They don't even literally know how it's grown. And so the physical space, especially during COVID, and in those most dense concentrated areas, has been incredibly powerful as a tool to help with like restoring wellness. It's been a really critical, and even for the staff. I mean, I was desperate to get back out there when it was safe. You know, and to have a space, and in the fall, last fall, for the harvest festivals, families who had been in homes with their children, we had harvest festivals, and they could literally come downstairs into their front yard, really, and have a party and a celebration that was safe and socially distanced in a way that's their own community is a really, really powerful experience.
So one thing, you know, I'll highlight on the Task Force for Racial Inclusion and Equity, you know, we identified in collaboration with the Department of Health a number of communities that were disproportionately impacted by the pandemic. No surprise, we're in one of those communities, right? We're in one of those critical frontline hospitals that serve New Yorkers every day, particularly in Black and brown communities. But we know that the hospital is an anchor in this community, but there are all these other stakeholders at play, right? You have the farms, the bodegas, the broadband, the work that you're doing. And so it would be great, and anyone can jump in here, to think about and share a little bit, like, what is the role that you see your organization, the work that you do, playing within this ecosystem, within a neighborhood that's addressing physical, mental health and well-being. And anyone can jump in on that.
Yeah, I think this is the perfect opportunity to highlight the farm that we literally just built in Melrose Houses that is like 4 blocks away, right? And I think when we looked at what communities we should be serving, we looked at the map of where we were already stationed, right? Where do we have the most gardens? Where do we have the most markets? And then I threw it off the table. I'm like, okay, let's go over here, right? Let's go to the places that people feel like they might not be thought about, or they might not think that, you know, this is for them. And I think that when you have these green spaces and you're like, not only can you grow food here, but let's have a workshop. Let's do peer-to-peer learning. Let's throw a birthday party here. Oh, you want to talk about what's going on in your apartment? Let's have a garden meeting and we're all going to talk about it and advocate for each other. So like having these spaces, but using them as community spaces, right? We don't necessarily need to be indoors to be in communion with each other. And so activating folks and then also encouraging other partners, like, hey, get in on this. You've been reaping the benefits of being in this community for so long. Now it's time for you to give back.
Yeah, I also want to highlight one of the hindrances to the needed progress toward health and wellness. And that hindrance is we monetize our problems. And what do I mean by monetize our problems? In addition to our program, you have Green Bronx Machine. Yeah. I mean, if you go and see what Green Bronx Machine is doing to these kids, you know, in the South Bronx, but unfortunately, they don't get funding that they deserve because the problems are monetized to a point where only well-established organizations that can write a proposal that answers every single question. Now, they answer the question, but they're not doing the work. Green Bronx Machine does the work. And Green Bronx Machine, and they are like Bronx River Alliance. You have these well-rounded solutions to our problems who do not have access to the funding. And the ones who have access to the funding, they're perfect at answering questions. But are they doing the work? The answer is no, because if they're doing the work, we will not be ranking 62nd out of 62 counties year after year after year. So what we need to do is we need to change the formula by looking at Green Bronx Machine, Bronx River Alliance, who are providing tangible solutions to the problem and start monetizing our problem. And this is also true to public sector. This is also true to education. This is also true to economic development. Let us start monetizing our problem and fund those who have the answer on the ground, such as Green Bronx Machine. Thank you.
Just if we're listening to each other, we understand that it's a matter of getting back to the basics. Education, health, and finances, right? Those three, and it's a cycle, right? Because if you don't have the education, right, then you won't have the health, you won't have the finances. If you don't have the finances, you won't have the health, right? So to your question, to the points that were made here, how do we get back to those basics? How do we get communities to start thinking about those three topics, right? So how do we get you educated so that you can make better decisions, so that you can make better decisions for your life, for your family, for your future, right? And some of those better decisions equal health, right? How do I skip, like you just mentioned, how do I skip the soda pop and pick up a bottle of water, right? I may not have the education, one, or I may not have the financing. So the soda can might be free. It might be the only drink opportunity that I have, right? So, or the soda can might be $1 versus the water, the essential water might be $4, right? Right, going back to economics. So I think it's and to what you were saying, having those community conversations to bring us back to the basics and bringing it back to mental health. I think, you know, most of the time when people are overwhelmed, right? When you start to peel the onion and to really find out, well, what is causing you to be overwhelmed? I'm overwhelmed. What is it? When you really peel that onion, it's, oh, well, I didn't have anything to eat today. Or I had a conversation with my friend and someone was hurt and I never got a chance to really unpack that, right? Or I'm cold. It could be something as simple, I'm just cold today. Or my body doesn't feel okay. You didn't get a checkup, right? Something's happening inside of you that you don't know about, but you don't have time to go and get the checkup because you gotta go to work. Because if you don't go to work, then you can't pay the bills. And if you don't pay the bills, the kids can't go to school. So it's this cycle of just getting the community to come back to the basics so that we can start solving these problems, right? And many a time when we have conversations and have community dialogue, it all boils back to the top three, and then now we can solve the problem. Then now we can connect each other. Oh, you not eating healthy food? Well, there's a farm, right? Let's get you some healthy food. Oh, I'm having issues with finances. All right, let's get you some workforce development opportunities, right? Oh, I just don't feel good. Let's get you over to Lincoln Hospital, right? So I think that's the way for us to really get all the communities to start thinking of community engagement that way.
Thank you. And you know, I would build on your point around, you know, there's changes that we can make in our lives as individuals, but then there's also these systematic changes, right? How can we as government, whether it's philanthropy, the private sector, resource the groups who are closest to the problem, who are solving the problems, right? How can we make sure that we see the groups that are on the front line as the solution and structure our response in that way? So I know that we're set a lot of.
It seems like, it feels like it's coming from a place of deficit. Like we're gonna lose something if we pick a healthy lifestyle. You know, the message is, this food that your mom, that your grandma, that someone is making for you is somehow toxic for me. It's killing me, and that doesn't sit well. And I think if we reframe it as from a place of abundance and look at as thinking about wellness and making healthy choices, eating more greens, you know, as a place, as an addition. You know, we're actually increasing our knowledge. We're able to add to this vast library that we got from our loved ones, and we can modernize it. We can put our remix on it, we can spin it, we can do these new things and bring new traditions and teach our kids these new ways of doing things by, you know, paying homage to the old ways and bringing in, you know, because we know how food in our culture means a lot more than just something that you put in your mouth, you know? Food represents love, you know, it represents our history, our culture. It brings you back to, you know, I still talk about my aunt's potato salad, you know? Like you think about these things and it means so much to us, and it's how we can keep those things and how we can see ourselves in this wellness, you know, picture. And how we can actually see ourselves as part of the solution instead of the problem as we're always framed on TV. Because we are the solution. And this pandemic has shown us that, you know, if we sit around and just wait for someone to come and save us, it's never going to happen. And so we have to really think about reframing it and seeing that we actually are the ones that we've been waiting for. We have all the answers. And you know, working with Tree, doing this engagement around vaccines at the beginning of the vaccine program, people instantly were like, oh, Black folks, Latin folks, no one's going to get vaccinated. And we knew that that's not true. We just knew that you have to talk to people and meet them. And the messaging wasn't on par. It didn't hit for folks. And so when we started to work with community groups and started to actually engage, have these conversations, we saw that people were bringing so much to the table, and they were bringing their whole self. They're bringing their cultural practices, they're bringing all of their resources, all of the skills that they have, and that's how we got new language to talk about vaccines, new language to talk about health and healthcare and community, and we can actually change the landscape. You know, we've been able to, you know, cause climate change by our action, but we can actually work together and cause other types of change. And that's kind of with the Black tradition, you know, in the spirit of abolition. You know, folks came together. We had never in this country seen Black folks as not being enslaved, but we all came together and were able to push through that and to create a reality that we can actually be free and we can actually move beyond this present reality that we have too. And that's part of the legacy that we bring in, that legacy of hope and that legacy of community. And so as we talk about nutrition and we talk about all of this, how we see ourselves in it, we were in the green room, we were talking about farmers. You know, we have some black farmers around us, and people think, well, that's not for us, that's white people stuff. No, black folks been farming for time, you know, in memoriam, you know, forever, and how we can see ourselves in this, and just wanted to, you know, pass to, I guess, yeah, if you want to talk about some of your farming experience, or the whole just thinking about nutrition and seeing ourselves reflected in wellness.
Yeah, I think, thank you, Dr. Williams. I think that a lot of the stuff that you brought up is so important. And I think another layer to that is like, how do we make healthy foods culturally appropriate for our communities, right? How do we encourage folks? Like, you don't have to stop eating rice and beans, right? But like, let's look at wild rice, right? Let's look at other forms of fresh beans instead of the canned beans, right? Let's make the sofrito from scratch, right? Like grandma used to do, right? And we store it and we figure out how to do that. So I think like that's also a part of that ancestral knowledge that we kind of lost when we lost some of our ancestors, is how to do the preservation of stuff. And then also just encouraging people to explore, right? Encouraging people, like once people have their basic needs met when it comes to their eating habits, they're willing to try new things, right? And so framing food not as a luxury, but as a human right, and making sure that folks have what they need to be able to sustain themselves. Because if you have that, then you're okay with trying a new sweet potato. You're okay with trying bok choy. You're okay with trying Swiss chard, right? But when you don't have your basic needs met, and you just have to think about, well, I only have enough money just for this, you're not gonna wanna try a new thing. You're not going to want to put yourself out there and be adventurous when it comes to being healthy, right? So it's like making it accessible, making it culturally relevant, making it easier for folks to be able to relate to the foods that we're telling them, well, this is better for you. If it's better for me, then make it easier for me to get it.
Okay, I want to ask all of you, everyone, to support the bodegas, the healthy bodegas, and support your local bodegas, because remember, the fresh fruit, they are short life. So when we buy, we need you to come to support, so we can keep offering you those healthy products. We be willing to keep educating our bodegas owners so they can help to transmit the message to the people. You should eat berries. And I have people that have gone to my store and they ask me for a bacon, egg, and cheese. I cannot refuse to sell it. But I have a good experience with someone that he bought it that day, and instead of getting a fruit punch juice, he took a waters and he took a bananas. The next day he came and he ordered a turkey sandwich. So it's how we educate our bodega owners, and they can transmit the message. They can talk to the people how good it is for them to eat better, to have a better health. So I ask to everyone, support your local bodegas. We need your support.
Yeah, and also I'm requesting support. We're working with elected officials because Bronx is not only the renters county, 80% of us are renters, but we also happen to be residents who get a lot of subsidy. Our housing, our food, our living expenses. What we're saying to the government is that prevention is the key, not managing problems. Right now we're managing problems because it makes a lot of money to manage problems than to prevent it. And therefore, they can talk all the talk, but those who are making money managing the problems don't want change. Because if there's no problem, there's no revenue. So that is the accurate reality. All right. We can prevent over 50% of the problems we're facing by doing simple things. We know type 2 diabetes. We know how people get type 2 diabetes, and we know how to prevent it. We know how to manage it. But rather than preventing it, we're managing it so that companies get money. So what we're saying to the government is that these renters make the subsidy smart. instead of allocating food stamp $200 to go to these grocery stores and maximize what they can get out of $200, why can't you give them $500 and then designate, where they can shop and license those shops so that people will not, because you don't give them the money. If they don't buy it, they will not, it's not accruing, they lose it. Every month you get 500 allowance for organic food and produce. And we read a study that says if we do that, we will save $5 billion in just diabetes alone for the state, $5 billion. And that makes a lot of sense. So we need people not to follow managing the problem, but really preventing it so that we can be healthier and we can be well off. And right now, all we're doing is managing preventable problems, and it is very costly. That's why we're talking about health disparities. Now, all of you experts said health disparities has no relationship to race or gene. It's all about, it's all about lifestyle and environment. Am I right? Lifestyle and environment. So if that's the case, and it is killing us, and it has killed us through the COVID, let's change it. Let's not manage it, let's prevent it. And by having smart subsidies, this also goes to public safety. There was a time where, bad people were not allowed to fest around housing developments. Otherwise, they kick you out. And guess what? We became safer borough because bad people not coming there. Now, there are a lot of activists who fought it, and unfortunately now we have bad people carrying guns and recruiting gangs and whatever. All I'm saying is that we have to be smart in subsidy so that we can prevent what is preventable. And most of the problems killing us, according to experts, are preventable. Thank you.
Yeah, I just want to speak to one point you made about regulating where people can shop. And I think that point takes away of the humanity of accessing food in some ways, right? And so I think instead of thinking, oh, how do we push people to do what I want you to do, is to think about how do we get these corporations and these supermarkets and these people that have been benefiting from our communities and not providing the quality services that they need to provide, how do we force them to provide the services that our communities deserve? Because I think that in a lot of conversations it's like, oh, well, we just need to force people to do this, and we just need to force people and communities to do that. And we're not always thinking about the other traumas that folks are facing. We're not thinking about transportation. We're not thinking about, how long is it going to take me to get to this organic shop that you're telling me to go to? We're not thinking about, okay, when I get there, am I even going to be serviced properly? Because I'm not from that community, right? And so it's like, instead of putting all the pressure on the person that is being negatively impacted, putting the pressure on the system that is negatively impacting folks.
I think this is a great example of what we talked about earlier, where it's allowing the communities to have a dialogue so that they can decide what's best for them, right? Because even in our conversations here, we're looking at different, we talked about this backstage, the different generations and the strategies that work, right? Because some strategies will work for some communities that are a little bit more conservative, right? Some strategies are going to work for other communities that might lean a little bit to the left, right? But I think the important, the most important piece here is the conversation, right? And the partnership with the leadership, right? I think that's the key here, because a lot of times, it's so funny, I was reading a case study where they were like, okay, they were speaking to millionaires and billionaires, and they told the millionaires and the billionaires that everyone seems to think that millionaires and billionaires don't have problems. And the millionaires and billionaires are like, what? We have problems. We have tons of problems. And when they read the case studies, some of the problems that the millionaires and the billionaires had, the people in the lower class did not have, right? So you started to hear stories where billionaires were saying, I wish I could go outside and breathe the air. I can't breathe the air because I have 7,000 employees that I have to think about, right? Then you had, on the flip side, you had people from the lower class that said, I wish I can just buy food. I can go to the grocery store without a budget, right? I wish I can just buy that slice of cheese, but I can't because I don't have the budget for it. So when thinking about, and I'm so happy we had this dialogue, it has to go back to every community having the freedom, right? Taking it back to Black History Month, the freedom to have the conversation, to make the choices for their own communities. And that's why I think it's important, bringing it back full circle, to have partnerships like with agencies like Manuel, right? With other agencies that are gonna give us the access to have these conversations, or open the doors for these dialogues and the resources for these dialogues so that we can identify, oh, okay, we need people to have more access. All right, let's look at which city agencies can do a little bit more, right, in their outreach to give people more access, right? Oh, we have numbers that are declining in these communities. Well, let's see what city agencies that we can talk to, or public-private partnerships that we can create, or private partners who are working, who are making revenues in those districts. How can we say, hey, can you pitch in to do a little bit more? So I'm just sitting back here listening, and I'm like, this is exactly what this panel is for, and I think this is exactly what the mayor was talking about when he mentioned it's up to us to do it, right? The resources are there, but we just have to start talking to each other. We got to have conversations with the community, and I'm really excited about that.
And I will just, speaking of solutions, make a plug that actually speaks to what you both are addressing. So there's a fantastic program through the Department of Health called Get the Good Stuff, which actually gives you $1 back for every $1 that you spend on healthy food, right? So you get an incentive, which is a great program. And in response to the pandemic, in partnership with the Department of Health and the Task Force on Racial Inclusion and Equity, we collectively, right, the city invested in expanding that program, particularly to the neighborhoods that have been most impacted. So that's information that we want to make sure that gets out there. But I think it speaks to both of your points, right? Like, how can we make sure that people are also incentivized, that they can get what they need, but they can also get it in the way that offers them the choice and within their own community. So I think that we're running close to time, and I see some questions. Wonderful. So let's take some questions from the audience.
Hello.
Hello.
Yes, my name is Junaidu Abdullahi Titipina. Folks just call me Mr. Titi. I am the president of African People Alliance. We've been organizing Black History since 2016 at Further University. And because of COVID last year and this year we didn't do it. And we are so glad this is happening here at Lincoln Hospital. And thank you, Sheikh Brahmi and his team, and Ms. Sharon Oliver and the team, and the mayor himself, and everybody that make it possible. But my remarks of today, the first thing is when I walk in, and especially when the mayor himself walk in, I didn't see Black history. It's supposed to be Black history. People dress up Black history. I didn't see it. People were supposed to dress a little bit showing Black history. And from the mayor to everybody, you don't look Black history. That's my first remark. And the second is a question. When you look at what's going on in England, England is already open. Wearing mask is a choice. And everybody now working in the office. Nobody work anymore at home or from home. So when are we going to be more freer in terms of working and not worrying much on anymore as COVID or whatever? Because what happened? I'm a small business owner. I'm a cloth maker. Or some people call me a designer. When it goes with worry, businesses, men and women as us, we struggle. So the more the city is open, or the world is open, that will be the beginning of people like us to prosper more. I used to have a permanent 4 workers. Right now, I'm with none, and it's very painful. So we need your help, and we need everybody to chip in with a positive mindset. Thank you very much for this dialogue.
Yes, thank you so much for your comments. I will speak to your first point and say that I am a young black farmer, a young black woman farmer, and I am Black history. And I do represent my ancestors and all the work that they've done in the agriculture field for me to be where I am today. And then to the second point is, when are we gonna get back? And I think we're gonna get back together, and it's gonna happen over time, and it's not gonna be easy, and it's gonna be uncomfortable, and we're gonna have to be willing to talk about things that we normally swept under the rug when it comes to American history, and when it comes to Black health, and when it comes to our relationships with hospitals. Yeah, it's gonna take some time, but we're getting there. We're doing it all together, and thank you so much.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much. I just find out you have this meeting here. I would like to be part of it.
You are.
I'm African.
Yes.
I'm American.
Yes.
I'm here more than 31 years. I'm here in this country. I work with New York City Department of Health. I know, I think one or two of them are my bosses down there. Welcome here. I find out we are here for celebrating Black Month.
Yeah.
Right?
Yeah.
I'm always in black. History. So we're talking about, I think, in health. I'm part of it. I'm a medical doctor. I can tell you, whatever we can do, the first thing is your health. Because if you are not healthy, you can do nothing. If you sick, your first thing is how you can be fine. Food, any disease, most of the disease we have is coming from food. What we eat. We have to know how to eat, when to eat, and how much to eat. But we're talking about prevention. Doesn't matter how much we give in organic food, we have fast food all around. Our children, they don't even eat home. Fast food, because it's there. My recommendation is for Department of Health, elected official, to tell those fast food people to know what they should do. Preventing, having healthy food for our own and our children. If not, doesn't matter how much we're gonna talk, gonna be vain talk. Because the fast food is out there all over the corner. Tell them, please find out the healthy food. Thank you very much.
Thank you. So do we have another question here? I see. There's one in the back.
This will be the last question. Thanks.
Thank you. To your conversation, you know, the conservative and so forth, one of the biggest issue here we have is with the federal government, is their subsidy. They're subsidizing the wrong food. They subsidize all the food we shouldn't be eating. They're not subsidizing, you know, your vegetables and so on and so forth. They're subsidizing all the starches. So we as a people have to approach our federal government and make sure that changes. We have to make it cheaper. Why is it cheaper to buy a steak than to buy vegetables? Okay, it's been brought out to me by some of the African people. Okay, and think about it. Yes, It is much cheaper. And to the question over here about the dress and so on and so forth, we as a community of color have to have the ugly conversation. You know, the other conversation, the messy conversation being to acknowledge that we are, and we have to accept ourselves from the Caribbean, from the United States, from Latin America, and from Africa, that we are a people. Until we have that, we're going to still be, we're still going to be sidestepping ourselves. We have to finally have that conversation. So to you, sir, this is the issue that we're having. Okay, I'll give you a quick one, and it'll be the last thing. In Puerto Rico, where my parents were from, before the last census, 2% acknowledged that there were people of color. Since this past census, it came up to 20%. They're having that conversation. They're getting their DNA tested, and they're realizing that. Okay, then? I'll leave you with that, and thank you for having this.
So, wait, quick point, and then we're gonna,
I just wanted to say that you just brought up perspective. It's really about perspective, and that we just need to continue talking.
couldn't agree more. Thank you so much for a wonderful panel discussion. Let's give a round of applause to our panel. And a round of applause to Dr. Watkins, our co-moderator. And a round of applause to yourself for staying in this conversation. And so, before you leave, we ask that you exit through that door and you try the Mayor Adams Power Smoothie. So Black History Month is about taking action, no time like the present. We have a special smoothie for everyone to try to kick off our journey of health and wellness. So thank you very much.